So today we're going to do some ultrasound. So we have a patient called Ronnie who came in with a right lateral ankle sprain after stepping in a gopher hole. So he's 2 days after his injury. He's had some imaging done that confirms that there's no fractures. Looks like it's sprained pretty good. He still has some pretty good bruising and some swelling there. So he's probably in the early inflammation stage. So I don't want to do any thermal ultrasound, because that's just going to irritate that inflammatory response. So I would do more just therapeutic ultrasound, just doing more of the sound waves, try to get the microstreaming effect and get that tissue healing effect going on, try to get his tissues to heal. So indications for this, he's in the acute phase of healing, and so we want to try to get those tissues to heal. Some contraindications that we should look out for is if he has a pacemaker, how his sensitization is, so if he has any loss of sensation down at the ankle, and then if we were doing it on his back, not to cross the spinal cord, things like that. So we're gonna come over to Ronnie. Ronnie, how's it going?
Good, how are you?
Good. My name's Kyle. I'm a student physical therapist working under the direction of Dr. Clausen. I understand you had an ankle sprain that happened 2 days ago.
I did, yeah.
Yeah, it looks pretty bruised and swollen right now.
Yeah.
Oh, sorry, go ahead.
No, I was gonna say stupid gophers.
You stupid gophers. You had gopher problems long?
Yeah.
Oh,
long enough.
Sorry about that.
No, it's fine.
How's it been feeling lately?
It's feeling, I mean, it just feels sore, and it's like really swollen, so like, I feel like I can't move it a ton.
Yeah.
But, yeah.
Okay.
It's not horrible, but it's just a little painful, a little sore, and just big.
Yeah. Well, I want to try something today, Ronnie, if that's all right, to kind of help, hopefully help that tissue heal a little bit better, and to hopefully eventually get that pain down.
Okay.
So it's called ultrasound. So a lot of people think of like the pregnancy ultrasound that they do when on a pregnant woman's stomach. It's kind of the same, but different. I'm not going to do any imaging, so I'm not going to be looking at anything in your foot. It's just going to send some sound waves from a machine into your foot and promote some healing in those tissues. Just kind of attract some of the things that is going to help your foot heal quicker and hopefully faster.
Okay.
Does that sound okay?
Yeah, sounds good.
Okay. So before we get to this, though, I need to ask you just a couple questions. Make sure it's safe for you. Make sure I'm not going to hurt you in any way. So I noticed on your chart it says you have a history of diabetes.
Yeah.
How's your feeling in your feet with your diabetes?
I can feel it.
You can feel it? Are you okay if I touch your foot a little bit?
Yeah, go for it.
So can you feel down here okay?
Oh yeah, I can feel it.
Okay, good. Doesn't look like there's any open wounds or lesions or anything.
No.
So nothing tore through the skin when you had your accident.
Nope.
Have you had any pacemakers?
I do have a pacemaker.
You do have a pacemaker?
Yes.
Okay. So since Ronnie has a pacemaker, I probably wouldn't put him through ultrasound if I could. If I had anything else that I could do, I'd probably do that with him. So I'll still take you through how to do ultrasound on Ronnie and pretend that he doesn't have a pacemaker. But if he did, it would be a contraindication, and I wouldn't do it. So Ronnie, we're gonna pretend that you don't have a pacemaker.
Okay.
And we're gonna do some ultrasound on the outside of your ankle.
Okay.
Okay? So, to set that up, I would come over here to the machine and turn it on. And then I'm just gonna come down here, hit the sound button. Okay, I'm probably gonna do it for about 5 minutes, since this is a very superficial tissue, small area. I'm gonna go to 3 megahertz, again for the it being a superficial injury in a very small area. And I want to do the duty cycle to about 20%. That way we're not getting any thermal effects. We're just doing the tissue healing effects and the sound waves. And then I would do the power intensity just to 0.5 or even up to 1, but I don't want to do anything more than 1. And so at this point, I would then take the ultrasound head, put a little bit of the ultrasound gel on there, right over the effective radiating area. And then before I turn the machine on, and I'm going to put this on your lateral ankle or your side ankle. It may be a little bit cold. I'm just going to spread it around, okay?
Okay.
So I kind of go around the area. Is this the area where you've been having some pain?
Yeah, it is.
Yeah, so I'm just going to go right around that area, no more than 2 to 3 times the size of the ultrasound head. Get that spread out before I turn this machine on. And once I turn it on, I don't want to remove the ultrasound head because that can damage the ultrasound machine and the head. So I'm going to turn this on while it's in contact with the skin and kind of keep it slowly moving. Now we do this for about 5 minutes. And Ronnie probably isn't feeling a whole lot because it's not doing any thermal effects. So mainly just working on that tissue healing, letting that microstreaming take effect. And that's how I would do it. So by the end, I would let him go 5 minutes. I would turn off the machine while it's still in contact and still moving. And then I could safely remove it. Turn off the machine. Clean off Ronnie. How'd that feel, Ronnie?
Feels good.
Good. And so if you feel like this is helping and it's helping that tissue heal, if it's still working on healing next time, we can do this again, or we may progress to something else.
Okay.
Sound good?
Yep.
Okay. And that's it for our ultrasound today.